My patient, Mr. Arjun, 23-year-old male, right-handed individual, Mason by profession, resident of Bihar, presented with complaints of back pain since 20 days and sudden onset of weakness of all four limbs 16 days ago. History of presenting illness: patient was apparently well 20 days ago when he started having pain in upper back. Pain was of mild to moderate intensity, non-radiating, and increased with movement and was increased with movements of limbs, upper limbs as well as lower limbs, and was relieved at rest. 16 days back, patient had sudden onset of weakness of all four limbs while traveling on a rickshaw, and the weakness was more in lower limbs than upper limbs. Patient was unable to walk or get up on his own. Patient also has loss of sensation and band-like sensation below nipples, associated, and has got bowel and bladder incontinence. There is no past history of loss of weight or appetite, no history of cough, breathlessness, or fever. Past history, there is no significant past medical history. Patient denies any past history of diabetes, hypertension, or pulmonary clots. And there is no history of trauma to spine. Personal history: patient is resident of Bihar, Mason by profession, smokes daily 2 to 3 BDs per day, and family history has got 7 siblings, all are well. There is no family history of tuberculosis.
Doctor, you will have to summarize your case.
23-year-old male right-handed individual, Mason by profession, presented to us with complaints of pain in upper back 16 days ago, 20 days ago. Pain was of mild to moderate intensity, non-radiating, and pain used to increase on walking or while using his hands to pick up something. Because he's Mason by profession, whenever he used to work,
You are asked to summarize your case. Your summary should be very brief, to the point, and be reflective of what you want to say in the end. Okay? So you said low mid back pain,
upper pain in upper back,
upper back pain,
non-radiating, and which used to increase on work.
On movements or work. For how many days? 20 days.
20 days duration.
What
And
is
16 days ago, while traveling on rickshaw, he had sudden onset of weakness of all four limbs, associated with loss of sensation below nipples, and with bowel bladder incontinence.
So, what happened to that weakness? Is it same?
Ma'am, the weakness is static. It was acute in onset and static.
But this was not reflected in your history. Your history should say what happened to the weakness, how did it start, how did it progress, what is its current status. It's been there for 16 days now.
Yes, ma'am.
What happened?
Every condition you must say
The
onset
weakness is
and
static, ma'am.
progression and
The
the
weakness has not
current status.
progressed.
So what is the weakness, doctor? What is happening? What all can he do? What all can he not do in your history?
Ma'am, the patient is unable to walk or get up, and the patient is unable to lift anything from his hands, like lifting a glass or a cup of water, or
His hands also.
yes, ma'am.
He has weakness in his hands as well as low limbs.
Lower limbs, yes, ma'am. Of all four limbs.
Of all four
Yes,
limbs.
ma'am.
So what all movements are possible with hands and what all movements are possible with legs? Nothing at all. He's completely immobile.
Ma'am, he is bedridden. He cannot walk or get up, and with his hands he can just.
He cannot walk or get up, I agree. Can he turn around in bed? Can he move his legs in bed? Can he raise his bed? That will give you an idea of the degree of weakness, truncal weakness. You have just said patient had sudden loss of inability to move all four limbs, and that is the end of the story.
And what about, you just made a passing reference of incontinence, he has incontinence of bladder and bowel.
Ma'am,
That doesn't suggest anything.
sir, his passing
Your
urine.
endeavor should be to find out if it is there, what kind of incontinence is it? Historically. What do you mean by incontinence of bladder and bowel?
He is passing urine and stools in the bed. He is unable to feel the urge of passing urine.
So then you have to describe
What is
it.
it? Retention with overflow?
Yeah. Does he have sensory bladder? Does he have a motor? What happened? Can he feel bladder sensations? Can he not feel bladder sensations? What happened to that?
He is unable to feel any data sensation or urge to pass urine, and
But he's not having any retention. Was he having retention? So you have to distinguish by history what kind of involvement it is.
And what happened to his limbs? Have they become stiff? Have they become loose?
they are flaccid.
No, you have to say all this. This has to come out on your own from the history so that then we can find out what is going on. So what do you think is happening here? What is the level of lesion here?
The level of lesion is
No. Where in the nervous system? Brain?
spinal cord.
Why did you say spinal?
Ma'am, because he's got quadriparesis
Okay.
with bowel and bladder involvement, with band-like succession around the nipples. So the lesion is in the spinal cord at the level of D4, and
Level
you
of
think it-
D4?
ma'am, that is the
Upper limb.
How will you explain the involvement of upper limbs?
if it is a quadriparesis, it has to be above C5. It is high cervical cord lesion, or there can be two different lesions in the cord.
So according to your history, what do you think it is?
Sir, it can be pot spine.
No, I'm not talking etiology. First I'm asking about, you think is a cervical cord involvement or it is?
Dorsal cord involvement or both cord involvement?
Sir, I think according to the history, it is involvement of both cervical as well as dorsal.
Why did you say that? Is there a patchy involvement, meaning some part of cervical and then there is normal and then there is... Only then can you say two levels of lesions. Do you understand the point?
And that is very difficult to explain, especially sudden onset and then
And every place,
static
at every
progression.
High cervical cord involvement.
High cervical
High-
would mean which level?
C3, C2, C3.
So what will be the other features with those? Does he have anything to say?
Historical, history.
There is no history of breathlessness which would show the diaphragmatic involvement. And
Any other history you may get? Or any other? Did you get some lower canal involvement also?
yes, sir.
Then you're not getting any history.
No
So
history.
you
You
need to
never
make
said
things explicit.
anything about cranial nerve in history. Especially if you are considering cervical cord, you should always mention what happened to cranial nerve.
In CNS history, you have to, on your history, you have to localize and think of etiologies of that. That how you take a history of CNS.
So if you say cord, what is happening with the cord? Is it compressive? Is it not
Then you
compressive?
have to take your history according to that.
If it is compressive, where do you think the level of lesion?
It is most likely compressive myelopathy because of the bowel and bladder involvement. Bowel and bladder involvement comes very late.
Early involvement of bowel and bladder goes in favor of
non-compressive
rather than compressive.
Compressive will present with motor, then sensory, and then blood.
So the fact that patient has early bladder and bowel would go in favor of non-compressive.
Symmetrical, all limbs,
That is why I asked you
motor and
again and again.
motor and sensory together.
What kind
everything.
of pain is it? Is it radicular, non-radicular? That is why you have to be very careful when you are talking about the mid-back pain or upper back pain. We said, is it radicular in nature? Is it radiating down a particular radical? So these, you have to be very cautious about these things. So what do you think? It is compressive, it is non-compressive? Cord involvement?
Non-compressive myelopathy because of sudden acute onset with initial involvement of bowel and bladder. Or simultaneously
And there is a level, sensory level. All these favorite to be a non-compressive myelopathy. This is one you have to say. Then you have to say the level. You say two different sites which you should not. Is there anything like called as watershed area in this spinal cord? You know anything of blood supply of the spinal cord where there are some watershed areas in two places in the spinal cord? I don't know. There are the cervical, the cervical thoracic, and then there is the lower down. And there the supply is from two. And so some areas may not be getting adequate blood supply
Blood
also. So if you say this is the side, you say this is non-compressive, then you have to talk about what is the possible etiology.
What do you think is happening?
Depending upon the acuteness of the illness, acute chronic, that will help you in finding the etiology.
So you have an acute onset non-compressive myelopathy. You are saying high cervical
High
cause.
cervical.
What do you think is the cause for high cervical in this patient? In a neurological case, your diagnosis should almost always be evident at the end of your history. You barely need your examination to confirm your findings.
Examination in most of the medicine is to see the extent of lesion and to confirm your suspicions of the history.
Anybody else? Would you like to give a cause?
Acute transverse
Acute transverse myelitis.
Can it be just acute transaction of thought? Maybe he was sitting on a rickshaw jumped, there was a trauma. But then in your history you never mentioned trauma. If you are suspecting spinal cord injuries, especially acute onset like this man was sitting in a rickshaw, it is very imperative you are suspecting non-compressive illness to say that there is no history of trauma. Was there a history of trauma in this?
No, ma'am, there was no history of trauma. He denied it.
What kind of trauma can cause cervical cord compression? Commonest type of trauma which causes cervical cord injury. The type of whiplash. And where do you get whiplash injury?
Driving.
Examination.
I'm Dr. Dinesh Kalas. Is conscious, well-oriented, type-based person. They can build night palate vision, no actors, no sinuses, no lymphadenopathy. Oral hygiene is fair. Hairs are normal. No neck hairs are enlarged. JVP is normal. No clothing, no sinuses. No pedal edema. There will be mild sector edema is present. And there is mild wasting of the lower limb. Mild wasting of lower limb.
Bilateral, uniform. Okay.
Blood pressure is
This statement is very nice.
Yes.
What do you mean by mild
What
waste?
is severe?
And with what have you
You
compared to
can,
say?
instead of saying mild wasting, you can say that I apparently see some thinning. And then you can confirm it when you've done a proper
Examination.
Otherwise, you will end up in some kind of a trouble by telling that there is mild wasting. If you notice that there is uniform thinning of the limbs, say that yes, there is probably thinning of the limbs. And subsequently, you can.
These words mild these are very vague terms in clinical medicine. Please avoid using these terms. I mean, to him, as the limbs, lower limbs appear thinner, he could have said there appears to be an apparent thinning of the limbs. That's all.
Neurological system examination.
Neurocutaneous markers बताते before going, because in any cord patient, any neurological patient, general physical examination, you must talk about neurocutaneous markers.
hair function is intact.
Neurocutaneous markers are here.
What are the neurocutaneous markers that you should look for? Anybody else?
Chagrin spots,
Diarrhea, fat,
Cephalo spots.
cafe or spots. That is very specific. It's not a neurocutaneous marker. Sorry? What else? Neurofiber.
Low hairline is a feature of. And when we are suspecting craniovertebral anomalies, only then we are going to talk of short neck and low hairline.
CNS examination, health function and type, speech is fluent and comprehensive.
ठीक है, type is okay. Speech हो गया, cranial nerves.
Cranial nerves are all cranial nerves appears to be normal. Motor examination is upper limb. With upper limb in the right side, there is power is around 5 by 5 and lower limb is around left side is around 4 by 5. In the lower limb there is flaccid paralysis, complete flaccid paralysis. In the wrist band there is 4 by 5.
The motor system examination, bulk,
Power, bulk, reflexes.
yes.
Yes.
What happened to the?
First you talk of the power, a tone.
Power.
Tell us a tone. Tell us
Tell
a
us the tone,
tone.
upper limbs, lower
Any
limbs.
bulk, any obvious
Bulk,
wasting.
wasting, when you were saying minimal wasting.
Lower limb is completely flaccid. And in the upper limb there is slightly increase in the tone. Bulk is okay here.
नहीं ऐसा ऐसे नहीं करते, पावर है तो पावर को अपर लिम लोअर लिम दोनों में बताओगे, फिर टोन को दोनों में बताओगे, अपर लिम लोअर लिम, फिर रिफ्लेक्सेस अपर लिम लोअर लिम। ऐसे नहीं कि सिर्फ लोअर लिम में पहले सारा बता दिया फिर अपर लिम में सारा बताया।
So in the lower limb there is no reflexes, there is complete flaccid.
Reflexes are the last.
Reflexes and flaccidity have nothing to do with each other.
You said power tone in the lower limbs was flaccid, and upper limbs you said tone was increased.
Yes.
You said bulk in upper limbs and lower limbs were normal. There was no wasting.
Upper limb is
Normal, lower limbs?
Lower limb is there is basically.
Both
वो
sides.
कैसे decide करा आपने?
Yes.
How did you decide that upper limb bulk was normal and the lower limb bulk was less?
There is slight difference in two sides. There is more in the left side.
What is a normal variation in the muscle mass on the circumference of the limb on two sides?
Blood test कुछ कराओ.
In a right-handed person, we always say that right-handed or left-handed person in neurological examination.
Right hand in the right side there is slight.
काम को.
Power, upper limbs.
आज को
Power in the upper limbs.
Power in the upper limb. Right side there is so at the shoulder line is a 5 by 5 and left side is also 5 by 5. In the elbow joint there is 4 by 5 both side of the elbow joint. In the wrist joint there is also around 3 by 5 to 4 by 5.
Also, we have to say which joint, which range of movement. Adduction, abduction, extension, flexion, elbow, I mean whatever. Extension, flexion, pronation, supination, small joint, individual movement. And if your power is 5 by 5 here and 4 by 5 here, how did you make it high cervical coordination?
And there is a hand grip is poor in both hands.
Hand grip is poor in both hands. Is there wasting of small muscles of hands? What is the status of these small movements here?
They are diminished.
What is diminution?
आपके
He is automatically, all the anti-gravity movements are also there.
जोर से बंद
It's
कर.
okay.
Cellulitis हो रहा है.
Cellulitis हो रहा है.
Normal है.
Doctor, he is able to do
Upper
against
limbs are
Dr.
absolutely
Sudhir's,
normal.
He cannot lift anything from his upper limbs.
which side?
Right as well as left. He cannot lift a glass of water. He cannot lift a cup.
What is locally their problems?
He's
Did
saying
you
that
see
he's
that?
got weakness.
Do you think there is some local problem? Just see.
Is he got cellulitis there?
This could objectively see. Is there any?
उसमें तो डॉक्टर ने कहा very serious cellulitis उसके hand में.
What about this side?
This hand.
Give your pen to grip. Give your hand to grip. मुट्ठी बंद करो जोर से. There is some weakness in that.
Okay.
Plus
Wrist. See the wrist.
he's for wasting of thinner and
You
hypothetical.
say that, that's why I asked you. That's exactly what I asked you. Is there wasting of the?
There is no wasting
See
of
the movement of the
thinner.
wrist, इधर खड़े होकर
Hypothinner में तो लग
इधर खड़े होकर सबको दिखाइए wrist में wrist joint पे क्या movements हैं, power क्या है wrist joint पे, show it.
Joint fix नहीं करना चाहते आप?
You should first fix the joint.
His one hand is occupied.
इसको आप ऊपर करो, ऊपर खाता करो, नीचे करो.
Yes.
Extension.
Okay.
First extension.
Okay.
How much?
What about?
What grade?
Fingers.
What grade is power?
Sir, 4/5 I would say.
About
So you can.
Okay. Now see at the elbow. See at the elbow. How much is power?
So, हाथ कैसे मोड़ो?
पहले बिना रेजिस्टेंस के देखना चाहिए हमेशा.
एक मिनट हाथ से.
Always ask him to bend his arm and elbow. हाँ, शाबाश. सीधी करो.
Now see
फिर
the
रेजिस्टेंस के अगेंस्ट देखिए.
अब मोड़ो.
Almost okay.
Say 4 है. Okay, fine. I agree with you. 4/5. What else?
अब हाथ सीधा करो. This is 4 plus.
Okay. Fine. What else?
Up there is the shoulder. See the shoulder.
Ask him to shrug his shoulders first, then apply resistance.
ये देखो दोनों टांगों को ऊपर ऐसे करो.
Abduction. Do abduction.
दोनों हाथ को ऐसे करना, ऐसे करना. पहले तो करो. फिर वापस सीधा करो अंदर. अब करके दिखाओ. वापस करो.
Put your
ये तो
pressure.
सबसे पहले किया हुआ है ना, ये पहले आप यहाँ पे प्रेशर लगाओ. हाँ.
अब बाहर निकालो. बाहर निकालो.
शाबाश.
कैसा?
अभी भी देखो, he is still circumducting it. You should prevent this movement from occurring. It has to be a plain.
It has to be straight like this.
It has to be just abduction. If he circumducts it, then it loses the.
हाथ सीधा करके बाहर की तरफ हाथ करो. 4/5. हाथ सीधा अंदर की तरफ हाथ करो. 4 plus 5.
So there is more weakness proximally or distally in the upper limbs.
Distally.
This is very good.
The very fact that he has got atrophy and weakness of small